Yeah, so I think it's a good time for people to take stock of where we are. We are clearly at the worst part of the pandemic that we've seen throughout, and it's continuing to worsen. We're seeing higher and higher numbers, not only of cases, but also hospitalizations, people in the intensive care unit, life support, and then, like we've seen before, sadly, additional deaths are going to follow. Without a doubt, we have surpassed our previous peaks by a substantial margin, and we plan to see that continue. I do want to share some information very quickly so that we can really understand what we're talking about and where we're missing opportunities because we're not as immune or as vaccinated as we need to be. Um, for the past month, essentially, we have seen that 98% of our new cases are going to be unvaccinated. We certainly are seeing people who are vaccinated and are coming down with COVID, but it's being overwhelmed by the younger folks, especially young adults, teenagers, and unvaccinated people in the mid-age ranges who are unvaccinated, who are making up the majority of the cases. When we look at our hospitalizations, 89% of our hospitalizations are unvaccinated and 86% of our deaths. As we've discussed before, there is significant spillover effect from the massive amount of transmission that's occurring in the population that is then impacting an older group of individuals primarily. If we look at this 14% of the deaths that are among vaccinated folks, that is really going to be people who are in the mid to late 70s on average, although not exclusively, or have weak immune systems for a variety of reasons. And that's one of the reasons why it's so important for us to be talking about these booster doses or these additional vaccine doses to protect folks who have waning immunity from their previous vaccination that may have occurred approximately 8 months ago. Let's look at our risk reduction by age. And so one of the things I want people to really understand is for every age group, we see a massive reduction in risk for cases, a 31-fold risk reduction for people in their 40s in getting the disease, a 40-fold risk reduction in hospitalization, and a 6-fold risk reduction for death. These persist into other age groups, 19-fold risk reduction for vaccinated folks, 50 to 64, 15-fold reduction for people 65 to 74, and a 6-fold reduction risk for folks who are 75 and older. We see clear and remarkable benefits from the vaccination in multiple ways. We know that people are surviving at much higher rates if they have the vaccine and they get COVID. And we're also seeing a lot fewer cases among people who are vaccinated. For the obvious reasons, we know that the vaccines are working reasonably well. They're not perfect, but they're working extremely well to slow transmission and to prevent serious illness and death. We're seeing a growing number of youth cases, and Dr. Byers is going to talk about that a little bit. That's not very surprising when we consider we started schools back. We knew there would be significant transmission in younger age groups. And we're also seeing increasing number of hospitalizations in those under 50. And we're seeing, a lot of cases in the younger age groups. Again, not very surprising, an under-vaccinated part of the population. We do want to keep reiterating that vaccination is our best way out of this pandemic. We've seen benefits for individuals, but also in certain scenarios like long-term care settings and nursing homes. We have, well over 160 long-term care outbreaks on a regular basis, but we're seeing very few deaths in those groups. Most of the cases are in employees, and we're seeing really a lot of benefit collectively for those folks as far as limited deaths, hospitalizations. And if you talk to people in the hospitals, they tell me, and they're amazed that they're not seeing nursing home folks in the hospital. That's because by and large, they've been protected by the vaccine. And even those folks we know are not going to respond as well as younger folks where the vaccine is going to be even that much more impactful. Vaccination is going to be our best way out of this. We know that it's very effective and it's extremely safe. We know that COVID has killed almost 8,000 Mississippians, but really seen very few side effects or bad outcomes from the vaccines. It's kind of remarkable the safety profile we're looking at. So plan A is going to be get vaccinated, but plan B is very important. We want folks who get COVID to make sure that they seek out and talk to their doctors or providers about getting monoclonal antibodies. This can reduce your hospitalization rate by 80 to 90%. It can markedly reduce your risk of dying. It's more and more widely available. We're working to expand our networks. We've added 10 different federal teams on the ground to help supply monoclonal antibodies that are being deployed. And we also have submitted a statewide standing order so that anyone who is diagnosed with COVID can directly seek care with monoclonal antibodies if they meet the criteria. And that way we don't have to go through a physician's visit We don't want that impediment. And also for people who don't have insurance can go ahead and get with the center where they can be screened for appropriateness and be treated with these monoclonal antibodies, which are immediately beneficial and can save your life today if you get COVID. Liz, that's all I have. I'll go ahead and kick it over to you or let Dr. Byers take it.
Well, Dr. Dobbs, did you want to talk about, and I may have missed it, did you talk about our vaccination rates and our testing rates?
Yeah. So thank you, Liz. We are really happy to see an increase in our vaccination rates. We did over 71,000 vaccinations last week, and over 50,000 of those were first-time doses. This is going to pay huge dividends in a few weeks, but it's not going to make a difference this week or even next week. This is something that's going to help us in the fall, in September. But still, this is a critical first step to making sure that we're protecting these folks, right? Because COVID's not going anywhere in the near future. And it's also going to help us suppress the transmission that's occurring in a rampant manner throughout the state of Mississippi.
Thank you, Dr. Dobbs. Dr. Byers, do you want to start with our daily numbers?
Thank you, Liz. I do. And I was going to try to share my screen in just a moment if I can get it to pull up. And suddenly I'm having difficulty getting to do that. So give me just a moment. And I want to share a couple of things with folks just to kind of give you some perspective of where we are. And this is information that you all have seen previously. But, today we're reporting out over 4,000 additional cases. It seems like every day our numbers are continuing to be high. And an additional 36 deaths. If you look at where we are to the far right of this epi curve, as we call it, and these are cases that are graphed as they occur by their date of onset or their date of positive test, you can see that we have now, looks like far exceeded where we were with the previous peak back in the winter months. And over the holidays of 20 and 21. And you can see how fast we've risen as well. And I think that's one of the things that we really want to highlight is how dramatic that rise has been. If you look at the previous large peak that we had over the holidays, it looks like it was a gradual increase, although we did see some rapid increases of cases. But with the rapid increase that we're seeing right now, that's one of the things that's putting a lot of the pressure on the hospital is that we're having so many cases that are occurring so quickly. And when you have a lot of cases, as we've talked about, that's going to translate into a lot of hospitalizations and unfortunately a lot of deaths. And when we look at our deaths, you can see now that it does look like we're beginning to catch up where we were with the deaths. We are starting to see some increases. We know that it usually takes a week or longer for the deaths to begin to increase after we see the increases in cases. And unfortunately, we are seeing that pattern now. If we look at our hospitalizations, and Dr. Dobbs did mention our hospitalizations, today we're reporting out over 1,600 individuals that are hospitalized right now with confirmed COVID-19. You can see how that compares with our previous peak back in January of 2021, when we were still in the middle of the surge over the holidays. And if you look at this over time, you can see that we've also had those increases in the number of patients that have required ICU care and increases in the number of patients that have required ventilator use to address their COVID. So we're continuing to see that same pressure on the hospitals, guys. It's really not slowing down. Let's transition a little bit to schools, and you know that we've put out quite a bit of guidance to schools in the K-12 settings throughout the state. And in addition to the guidance that we've provided them around vaccination for eligible groups, making sure that indoor masks are universal in all K-12 settings, regardless of the vaccination status, and making sure that the schools have access to testing so that they can do some routine testing of asymptomatic individuals who are unvaccinated in order to identify those cases and get them removed before transmission occurs. And certainly that's one of the things we're actively doing. But this is a snapshot, and this is data that we report out on our website. Excuse me. And you can see that since school began, we now have over 20,000 kids that are currently under quarantine, and that was for the week of August 9th through August 13th. And you can see that these are dramatic numbers when compared to the number of schools that actually reported. It was about 800. You can also see the overwhelming numbers of cases that we're seeing in students and in teachers. Remember that the schools are reflective of what's going on in the community. A lot of this is reflective of the high levels of community transmission that we're seeing throughout Mississippi and all counties. And certainly we're seeing those same numbers of cases in the school setting. And when you look at a number like 20,000 students that are on quarantine in any given week, that exceeds what we experienced in January, in December, in February, when we were at our previous peak for the impact on the schools. So we're actually seeing a pretty significant impact on the schools right now. Certainly in many cases, it's translated to a number of schools that, because they've had so many outbreaks or because they've had so many absences due to isolation and quarantine, that they've elected to go virtual for a short time in order to interrupt transmission and continue the kids with education. And, you know, of the schools that have reported to us, excuse me, we have at least 29 schools that have reported to us that they have elected to go virtual for a short time because of the increased outbreaks and the absences due to COVID. And when we look at our data, and it's not surprising to see that the kids in the younger age groups are actually one of our fastest growing populations of where we're seeing cases now. If you look at the children who are aged 5 to 17 years of age, you can see how dramatically the number or the proportion of cases associated with those children has risen. And when you look at it a little bit more detailed, you can see that a large part of the growth is in children aged 6 to 10. Now, the more cases that we see in children in this age group, unfortunately, this will translate to potentially more hospitalizations of children under the age of 18. And unfortunately, we may see additional deaths, but we hope that we don't for children because it is extraordinarily tragic. Now, we do have a number of schools that have signed up to participate in the testing programs, of which we have a couple that we've provided from the Department of Health. We either provide the schools directly with test kits and provide them support for them to be able to do the testing themselves on asymptomatic folks, or we have a vendor that reaches out individually to the schools and provides this testing for them. And again, this is just one of the layered components of a plan to reduce transmission in the school setting. And we do have 29 schools that have already signed up to receive those tests that we provide. And that's great. And we're working with them, and we'll continue to work with them and provide those tests. We have an additional 21 schools that are in the process of signing up with our vendor to be able to have on-site testing directly through our vendor contracts, and an additional 25 schools that are still in those discussions with our vendor. And so, you know, we're going to continue to facilitate for all interested schools doing and making that testing available. Additionally, apologies guys, additionally, we have 72 schools that are participating in schools and school districts that are participating in the Adopt a School vaccination program for providers to come directly on site and provide vaccines for those eligible individuals. And one last thing I did want to share before we finish, guys, and I want to go back to this slide that that Dr. Dobbs previously had, and that is the vaccine breakthrough deaths that we're seeing. And he did mention some data regarding those vaccine breakthrough deaths that what we're seeing is a median age of now 79 to 81 for those individuals who have been fully vaccinated, who now are dying as a result of COVID. And 85% of those individuals are over the age of 65. The majority of these people have underlying medical problems that affect their immune response to the vaccine. And so, as you know, we have, and CDC and the ACIP have now recommended an additional or third dose for groups of individuals who may be moderately or severely immunosuppressed. And, you know, providers now have the ability to assess their patients to determine whether or not they feel like they have one of those conditions that might result in decreased immune response from the vaccination. And those things include, you know, undergoing cancer treatment. You've had an organ transplant. You're taking medications that suppress your immune system. You have an immune problem that you were born with. Really, what the physician feels like is the cause for your poor immune response. They are allowed now to provide a third or additional dose for those individuals. Now, right now, it's the physicians and the pharmacies and the providers throughout the state that are doing this, but we are looking to be able to provide this at our county health departments starting Monday, August 23rd. We are in the process, and we will soon have the scheduler active so that an individual may go online on our scheduler the way that they have always gotten an appointment for a vaccine and answer some questions about their immune status. And if they have one of those conditions, then they can go ahead and get an appointment for that additional or that third dose of vaccine. So I think that's pretty much everything. That was a lot, I know, and certainly we can answer specific questions about those, Liz, or any other details as we go along.
Dr. Byers, can I get you, we did have a lot of media asking about pregnancies and deaths since the pandemic began, and the number I have is 109 pregnant women and 6 deaths. Does that align with what you have?
Yes, ma'am, that is correct, and that's from the very beginning of the pandemic, since we started tracking that data back in March of 2020, and unfortunately, we have seen death among pregnant women, and most recently, we saw a couple of deaths in very young women in their 20s who were pregnant in Mississippi, and it's unfortunate, and that's one of the reasons why we're strongly recommending not only that everybody who's over the age of 12 who's eligible for vaccine, but really we need pregnant women, we need women of childbearing age to really pay attention to this, because we know that there can be some bad outcomes during pregnancy with COVID infection.
And also sadly, last weekend, we had our 5th pediatric death. Did you want to talk a little bit about that?
Yeah, you know, that is true. We did have a death in an individual under the age of 18, a teenager, that was reported to us. And you know, unfortunately, what we're seeing, and we may see this more as we move forward, we need to make sure that not only are we providing the appropriate guidance for schools to make sure that the children are staying safe when they're in the schools, but we need children 12 and older to be vaccinated. That's going to be their best protection from infection and from the severe complications that may occur as a result of infection. And we need parents to be vaccinated around those children to protect them as well.
You know, I think a lot of people say, well, I'm healthy, I may get sick with it, but healthy people die too.
That is true. Most children do not have a severe illness or severe complications, but unfortunately, it can occur. And we do see it. And we have had tragically 5 deaths in Mississippi in children under the age of 18. And one of my worries is that the more cases that we see, the more that's going to translate into hospitalizations and ultimately into more severe outcomes in those children. We really need to make sure that we get them vaccinated.
Thank you so much, Dr. Byers. Mr. Jim Craig, let's talk about critical care capacity and some of the creative and generous ways that we are dealing with that situation and decompression of the hospitals.
Yeah, thank you, Liz. And first, I'd like to give you an update on that critical care situation, as well as a little bit of an operations briefing on where we are with the hospitals and some of the assistance that we're providing. The COVID system of care remains active in the state of Mississippi, and is still mandatory for hospitals in the state that are transferring patients for critical care services that can't be accommodated by the normal referral process that we use in the state. We do have the health officer order for the COVID-19 system of care that was renewed through the end of August, and it includes the delay of tier 1 and 2 elective surgeries that may still lead to an overnight hospital stay. The updated order also includes some further explanation of our bi-directional component of the COVID-19 system of care plan, which advises our transferring facilities that after a patient stabilized, they can be transferred back to the hospital of origin through our MedCom process. Returning some of these patients to the transferring facilities obviously will help make room for patients in need of critical care services in our larger care facilities. MedCom reported today that since the system was activated, they've transferred over 822 patients in the state of Mississippi for critical care services. As you know, hospitals self-report their information to MedCom twice a day, and the 8 o'clock report this morning reported 6 ICU beds available with 46 patients waiting on those beds. Obviously, the pressure on our healthcare system, while it's terrifying and unnecessary, still remains and worsens. People are waiting in emergency rooms right now for beds. The report as of 8 o'clock this morning, 251 Mississippians are waiting in an emergency room for a hospital bed. Obviously, we're very thankful to our federal partners at the VA. They continue to provide 5 ICU beds at the Biloxi VA and 5 beds at the Jackson VA to participate in our COVID-19 system of care patient rotation. And we're very grateful to the partnership with MEMA and UMC and the governor's office in coordinating additional beds for ICU use and the administration of monoclonal antibodies. A couple of things in that area is we have components of Mississippi Med 1, which is one of our 50-bed hospitals that is still functioning in the UMC parking garage to assist with decompressing emergency room. It's a 13-bed unit that was established and staffed by 39 National Disaster Medical System DMAT members, or DMAT is Disaster Medical Assistance Team members. In addition, we this week requested 7 additional U.S. Public Health Service team members to come in, and they're on the ground now, assisting UMC to assist with the administration of monoclonal antibodies near that same site. Right now, this team is slated to complete their mission on August 24th, 2021, and I'll talk in a few minutes about future plans for that. We're also very thankful to Samaritan's Purse that's establishing operations in Garage C over at UMC to help with statewide transfers in the COVID system of care, as well as helping us decompress overly congested hospitals around the state. The facility will consist of a 32-bed unit. Of those 32 beds, 5 will be ICU beds, again, very critical to our critical care rotation. We also have a 33-member NDMS DMAT team at North Mississippi Medical Center. That's a federal team assisting with hospital decompression in that location. Currently, this team is slated to end their mission on August 27th. For both of these missions where we have the DMAT teams in place, HHS reports that we will have replacement teams moving toward Mississippi. Some of those may start to arrive as early as this weekend, and the balance of them should be on the ground next week. So I'll have more details about the arrival of those groups in next week's briefing. Staffing for hospitals remains a critical need around the state, and and we're still nowhere near the staff we need for the beds we need. 73 hospitals requested over 1,451 personnel. Those hospitals report that the additional staffing, if we can figure out how to get that staffing to them, will open up 771 medical surgical beds and 235 ICU beds that are currently unstaffed. Again, the Governor's Office of MEMA are working to contract additional healthcare resources to assist in those staffing projects. We have developed task orders for all of the level 1, 2, and 3 hospitals in the COVID-19 system of care. That's 33 facilities that have been completed and are in process. And the remaining facilities, we're working on developing their task orders now. Also on the EMS front, emergency medical services, ambulance services in our state are extremely busy supporting 911 calls in their local communities, as well as moving patients around in the COVID-19 system of care, as well as just routine transfers around the state of Mississippi. Because of the limited staff availability that we're seeing in the hospitals, it is extending their turnaround time to get back to their county to respond to 911 calls and other emergent transfers. So you may just need to be conscious that we'll have to be patient with the EMS services as they're trying to get patients moved around the system of care, with the system being as tight as it is right now. So to assist with the hospital staffing, EMS is also standing up to assist. Today, we issued a health officer order that permits certified paramedics, advanced emergency medical technicians, and EMTs licensed in the state of Mississippi, acting under medical direction to care for patients in a Mississippi licensed hospital emergency room or other part of the facility while not on duty with a licensed EMS agency. They'll do that within the scope of practices identified by our laws, rules, and regulations and detailed in the National EMS scope for their particular level of certification. That's going to be a real benefit and a request that we receive from a lot of hospitals to allow EMTs and medics to extend some of the services into the hospital setting. In addition, we've received 10 two-person federal teams to assist in the administration of monoclonal antibodies. Those teams began working yesterday and are in addition to some of the current resources that we have, including our COVID-19 centers of excellence, which are spread throughout the state at most of your larger hospitals that you see. These teams, additional teams are currently located at Highland Community Hospital in Picayune, at Merit Health River Region in Vicksburg, Merit Health Natchez, Bolivar Medical Center in Cleveland, Claiborne County Medical Center in Fort Gibson, Baptist DeSoto in South Haven, Baptist Medical Center here in Jackson, the Cough and Fever Clinic with Forest General Hospital in the Hattiesburg Clinic, Anderson Region Medical Center in Meridian, and Singing River Hospital in Pascagoula.